My name's Steve Kelanic. I'm an ear, nose, and throat surgical specialist. I'm board certified. I'm considered to be a general otolaryngologist, which means I take patients of all ages, male and female. The way that I got into medicine, my mother was a nurse, so I was always exposed to the medical field as I was growing up. Had a pretty good sense that when I went to undergraduate, I was going to do something at least with the sciences. Went into medical school, enrolled in medical school, and was actually planning on becoming a pediatrician at first. I took an elective in ear, nose, and throat surgery, specifically to have a pretty good sense of how to examine kids, and it was just like something clicked. I mean, very often you'll see a child will come in with, speech delay, recurring ear infections. I mean, just something so basic as a set of, ear tubes. And you see the kid a month later, you see them for post-operative visit, and the family's thrilled because they're able to hear. Their speech has changed. It's a whole different kid. So again, there's a lot of personal satisfaction that you gain from that. Our office is a relatively new office. We've been in this current building for approximately 4 years. The staff has been working together for, gosh, I want to say about 9 or 10 years or so. We know how to work together. We know how to communicate. It's the same staff every day. The patients come back 4, 5, or 6 years later, and you see the same faces. So I think that patients would appreciate the fact that there's a level of continuity, from year to year, from day to day, year to year. I really like to treat the patient as an individual. Every person comes in. I think it's important to sit down, take the time, talk to the patient, let them explain what their concerns are. It's also nice to be able to work with them, and it's kind of rewarding at the end. You basically feel like you did something good. Like you helped somebody out. You created a difference for somebody, and created a difference in their lives.